Hello, everybody. Welcome. Today, we are going to talk about a very important topic. This topic is important not only in India but globally. The topic is Sustainable Development Goals. Now, Sustainable Development Goals are primarily a set of 17 goals and then several targets identified according to those goals. These goals are very important because they talk about the survival of our collective lives. And when I'm saying collective lives, we are not talking about only the lives of the present generation, but also the lives of the future generations. So these sustainable development goals are important for the present generation as well as all future generations that we may think of being in this world. So often we say that these are important for people as well as planet. Sustainable development goals are a departure from Millennium Development Goals, although they are taking support from the achievements of the Millennium Development Goals. But the approach here is more inclusive. Basically, there is a reflection of economic development goals, then social development goals, then human development goals, and environmental development goals or the sustainability goals. So, all the benefits of any particular system of development will be meaningless if we are not in a position to sustain those things. This sustainable development is taking into consideration the sustainability component. As we know, Millennium Development Goals were a set of 8 goals, and here we are talking about 17 goals. So, yes, I have prepared my slides for this presentation, and I'm going to share this. Here are the slides. Uh, yes, so let me share with you that this topic of sustainable development goal is having some kind of thematic continuity with some of the previous lectures that we have delivered here. And let me develop some kind of connectivity with all those lectures. So in lecture 17, we talked about the background of health policies in India. And you may remember, we talked about several events and developments, including the Alma Ata Declaration of 1978, the first health policy of 1983. And then in lecture 18, we talked about the Millennium Development Goals. There we talked about the 8 goals in general and the specific health related goals. And then we talked about National Health Policy 2002 in lecture 19. There we talked about the specific progress made in India and the specific targets related to the National Health Policy. Now, this Millennium Development Goal will address basically the things in 4 sections. First, understanding sustainable development goal. Second, 17 specific goals which are identified for next 15 years, 2015 to 2030. But I'm sure that these goals will remain relevant not only for the period up to 2030, but I think next 4, 5, 6 decades or maybe the whole century. Then the specific targets related to health, but because health has some close connectivity with food, poverty removal, sanitation, and water, and there are goals related to these dimensions of development also. So try, we will try to talk about these goals also along with the health goals, and then the facts and figures related to all these goals, because what is happening globally, we need to have some kind of understanding. We need to remember that these goals are very comprehensive and these are equally important for all regions of the world, basically all developing countries. These are equally relevant. So now we come to understanding sustainable development goal. We can go for a definition of sustainable development, but I think we need to have a look on those 17 goals, because once we have a look on those 17 goals, then it will give us some kind of strength while we are talking about, while we will discuss the definition and other things. So just have a look over those things. Well, this is a picture of those 17 goals as released by United Nations, and I think most of you might have seen this at some or the other level. And here are those 17 goals. Goal number 1, end poverty in all its forms. Goal number 2, zero hunger. Goal 3, health. Goal 4, education. Goal 5, gender equality and women's empowerment. Goal 6, water and sanitation. Then next goals are energy, economic growth, infrastructure and industrialization, inequality, cities, sustainable consumption and production. And then the remaining goals are goal number 13, climate change. This is very important from the environmental perspective. Goal number 14, oceans. We have not been talking about the water life as such and the lives within oceans. So these oceans, climate change, biodiversity, forest, desertification, then peace, justice, and strong institutions and partnership. Almost everything related to the environmental dimension of life. So you may see that the goals are divided in 3 sections, and you will get to know about these things in our next discussion. So having an idea about what these goals are all about, now we come to the definition part, or try to understand what is this sustainable development. But I'm sure that some of you are already familiar with this, so I won't go for a lengthy discussion here. Sustainable development has been defined as development that meets the needs of the present without compromising the ability of future generations to meet their own needs. It's very simple that when we talk about the need fulfillment, then the present generation should try to fulfill those needs in such a way that we can leave enough resources for the future generations. Or in other words, we should not exploit the resources in such a way that we should not leave anything for future generations. That means there should be an intergeneration equity. The resources should be exploited in such a way that the needs of the present generation could be fulfilled, and the future generations should have enough resources. And we don't know how long life will continue in this planet. That means we need to leave enough we need to leave enough space for the survival of all future generations. And hence, when we take into consideration the needs of the future generation, this becomes very important and very challenging. And that is why the sustainable development goals are very important, because here we have identified 7 areas in which we need to take care of the needs of the future generations. Sustainable development calls for concerted efforts towards building an inclusive, sustainable, and resilient future for people and planet. So we are not only talking about people, we are also talking about planet, because climatic conditions are making the planet a difficult place to live in. So we need to take into consideration the needs of the human beings as well as the needs of the planet or the collective life as such. And that is why we are talking about sustainable development. For sustainable development to be achieved, it is crucial to harmonize 3 core elements: economic growth, social inclusion, and environmental protection. So these are the 3 core areas: economic growth, social inclusion, and environmental protection. These elements are interconnected and all are crucial for the well-being of individuals and societies. All stakeholders, the governments, civil society, and the private sector and others are expected to contribute to the realization of the new agenda. So basically, we are talking about 17 goals, all these goals which could be divided in these 3 core sections: the economic, the social, and the environmental. And then we're talking about the stakeholders. The governments are the stakeholders, the private players are the stakeholders, and at the same time, the civil society is the stakeholder. The civil society that consists of people like you and me and all other common people who are neither part of the government nor part of the corporate sector. So this identification of three specific set of stakeholders is again very important thing. At the global level, the 17 Sustainable Development Goals, as we just saw, and 169 targets of the new agenda will be monitored and reviewed using a set of global indicators. So there are indicators, there are targets, and there are goals. The goal indicator framework for sustainable development goals was developed by the interagency and expert group on SDG indicators and agreed upon at the 48th session of the United Nations Statistical Commission held in March 2017. So we have the goals, we have the indicators, and we have the specific targets. However, very often people may ask or may think that are these goals legally binding? The answer is categorically mentioned in the website of United Nations, where they have mentioned the SDGs. No, these goals are not legally binding, but these are our mutual and well recognized needs. These are necessary for our own collective survival. So, although these are not legally binding, but these are morally and socially binding. These are more important thing is this, that these are morally and ethically binding, because if we are not going to follow these things, then perhaps others may also get affected. But the first, those who may get adversely affected would be the people belonging to that particular nation state or that particular nation state as such. Nevertheless, countries are expected to take ownership and establish a national framework for achieving the 17 goals. And that is why nation states need to take this responsibility. Implementation and success will rely on countries' own sustainable development policies, plans, and programs. Now, the goals have been identified by those global agencies, but it depends upon the countries to adopt those goals as per their own national policies, and then they need to devise their own implementation mechanism, plans, and programs. So here, it should be clear that these goals have been identified for all nation states world over, and it is the responsibility of the nation states and the respective governments, and not only the governments, but also the private players, also people at large, to take care of these goals. There are 169 targets and 17 goals, as we have already mentioned. These goals go further than the MDGs, that is the Millennium Development Goals, by addressing the root causes of poverty and the universal need for development that works for all people. So MDGs basically talked about 8 goals, and you may remember we talked about poverty, hunger, then health related goals, and then global partnership, etc. Those were very specific because those aimed at achieving the goals from human development perspective, and the three core components of that human development perspective were economic development, that is income, and then education, and then health. So all those 8 goals were actually related to these core three thrust areas. But here in sustainable development goals, we are focusing not only on the human development perspective, but we are focusing on economic development, social development, human development, and most importantly, the sustainability targets or the environmental integration of those development goals. Building on the success and momentum of the MDGs, the new goals cover more ground with ambition to address all 17 goals and a specific target. But certainly, the SDGs came into existence only because of the success of MDGs, only because the world came to a single platform through the Millennium Development Goals that the potential or the vision of the SDGs came into existence. So there is a very meaningful link between MDGs and SDGs. The new goals are universal and apply to all countries, whereas the MDGs were intended for action in developing countries only. Yes, this is very important. As we stated, Millennium Development Goals a specific focus on three core areas which were very relevant in developing countries because income, education, and health related things were lagging behind in developing countries. But here, the 17 goals which have been identified are not only taking into consideration the interest of people living in developing countries only, but also in developed countries. So here the whole world is coming into one single platform. The targets, the indicators, and the goals are equally relevant and applicable for all the countries. The new goals recognize that tackling climate change is essential for sustainable development and poverty eradication. The most important thing is this that we have related all the existing goals with the goal of climate change. We know that globally the planet or the world is witnessing severe, abrupt climate change, and there were several covenants and conferences and developments related to climate change in past 2 decades, or you can say 3 decades. So all those progress are coming together and manifesting themselves through these sustainable development goals. Now we already had a glimpse over these sustainable development goals. We can see that there are different goals. Here, the focus is on health related goals, but because of the close proximity of health related goals with some other goals, we'll talk about those goals also. But the focus is on health related goals. And this is goal number 3. Can have a look here. This goal number 1 is talking about no poverty. Goal number 2 is talking about zero hunger. And goal number 3 is talking about good health and well-being. 4 is on quality education. 5th is on gender equality. 6th is on clean water and sanitation. So we are going to focus here on this good health and well-being, and then we'll take into consideration some of the other things also. So what are the goals? By 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births. Goal number 3, target number 1, that is 3.1. First thing is related to reducing maternal mortality ratio. We talked about this in when we were discussing Millennium Development Goal or the National Health Policy. Then next one is end preventable death of newborn and children under 5 years of age. The newborn, neonatal mortality, infant mortality, and under 5 mortality. Now these are basically, these targets are set for all people all over the world. Then 3.3, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical disease and combat hepatitis, waterborne disease, and other communicable disease. Now, we need to take into consideration the other communicable disease because COVID-19, as of today, we are witnessing a global pandemic, and this is a communicable disease. So the health goals of the SDGs do talk about all possible communicable disease, and that is why if you see the website of UN, you'll find that there are so many issues related to COVID-19. Each and every page related to these SDGs also talk about the COVID-19 related goals and action plan. So basically, this goal 3 is taking into consideration all the known disease as well as other possible communicable disease. Then 3.4, by 2030, reduce by one third premature mortality from non-communicable disease. Now, first we talked about the communicable disease, and now we are talking about the non-communicable disease also, because we know that the world is under the threat of occurrence of or spread of several types of disease. So these health related goals are taking into consideration the known disease as well as the unknown disease which may come into existence, but we need to keep the world prepared to address all those problems first by controlling all the known and then remaining prepared to control the unknown. It also talks about other important things: prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. So we know that the world is witnessing problems related to substance abuse. Different age group people coming from different age group are actually becoming victim of substance abuse. Here we have a clear target related to that. Then halve the number of global death and injuries from road traffic accidents. So basically, the accidents and the traffic accidents are creating huge mortality, premature mortality. This needs to be addressed through trauma care and emergency care. And then universal access to sexual and reproductive health care services, including for family planning, information and education, and integration of reproductive health into national strategic programs. We talked about reproductive health. We know that these are very important areas, and these are also related to basically one another specific problem that became a global pandemic, that is AIDS and HIV. So these are all interrelated. And then we talk about a very important topic, that is universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicine and vaccines for all. Universal health coverage is a very important goal. It talks about extending health facility up to all uh, uh, people, uh, so that each and every person can get benefits of health facilities. It talks about different modalities. We have one more topic related to universal health coverage, and we'll talk about this at length there. Then reduce the number of death and illness from hazardous chemical and air, water, soil pollution and contamination, all types of pollution and contamination. And then there are a few other goals also, a few other targets also within this health and well-being goal. Uh, World Health Organization Framework Convention on Tobacco Control in all countries. So, strengthen the implementation of the tobacco control. Yes, we know that one of the important cause of cancer and several other types of non-communicable disease is the use of tobacco products. So here we talk about this also. Then research and development of vaccines and medicines for the communicable and non-communicable disease. As of today, because of COVID-19, everybody is talking about waiting for literally the vaccines. So here, even before the occurrence of this type of problem, the Sustainable Development Goals have already identified this area related to research and development of vaccines and medicines for the communicable and non-communicable disease. Then access to affordable essential medicines and vaccines. Affordability is again very important thing. Then talks about public health. Then talks about also providing access to medicine for all. So some of these things we have already discussed while discussing public health. Then it talks about increasing health financing. Basically, health expenditure is one important cause of impoverishment. So, how to combat that? Yes, that can be combated only through health financing. We talked about NHP, National Health Policy 2002, and we talked about the health funding. So this health funding and health financing is a very important issue here. This target is talking about that also. And then strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction, and management of national and global health risks. Yes, this national and global health risk. Now, this COVID-19 has already made these things so familiar that what kind of warning system and what kind of network system we are having globally. So these were the targets related to health and well-being. Now there are certain facts related to the state of health and well-being globally. We need to keep in mind these facts and figures because these facts and figures actually compel us to think of those targets and goals. Uh, these are divided in three, four categories. First, we'll talk about the child health related facts and figures. In 2018, an estimated 6.2 million children and adolescents under the age of 15 years died, mostly from preventable causes. Now, such a huge mortality because of preventable causes is basically a kind of stigma on the name of scientific research and humanity. All death caused because of preventable causes should be prevented from occurrence. Then there are so many numbers mentioned here. Despite determined global progress, an increasing proportion of child death are in sub-Saharan Africa and Southern Asia. If we see the global map, we find that sub-Saharan Africa and South Asia is the area where most of these deaths are taking place. 4 out of every 5 deaths of children under age 5 occur in these regions. The sub-Sahara Africa and Southern Asia is witnessing 4 out of every 5 deaths of children under age 5. That means uh, uh, it's a huge problem area or an area which is deficient in health related facilities and infrastructure. Children in sub-Saharan Africa are more than 15 times more likely to die before the age of 5 than children in high income countries. This is a great, huge, unacceptable kind of disparity. What is happening in sub-Saharan Africa and South Asia is or should be unacceptable to the whole world. Then malnourished children, particularly those with severe acute malnutrition, have a higher risk of death from common childhood illness such as diarrhea, pneumonia, and malaria. Nutrition related factors contribute to about 45% of death in children under 5 years of age. So there is a picture related to under 5 death and death of children in the South Asia and sub-Sahara African regions. Then maternal health, yes, there are specific facts. Over 40% of all countries have fewer than 10 medical doctors per 10,000 people. Over 55% of countries have fewer than 40 nursing and midwifery personnel. This reflects the lack of medical staff, and all these figures mentioned here are actually talking about either the premature mortality or lack of infrastructure or lack of facilities prevailing in different regions of the world. Then the HIV, AIDS, malaria, and other disease related facts. 38 million people globally were living with HIV in 2019. And then the world has witnessed 690,000 people dead from AIDS related illness in 2019. So, although we had AIDS related goals in the Millennium Development Goal, we wanted to stop all such deaths, but this is continuing and not in a small quantity, but in a huge quantity. 75.7 million people have become infected with HIV since the start of the epidemic. So, tuberculosis remains the leading cause of death among people living with HIV. That means the problems are prevailing, and there are several numbers available which show us the state of illness, disease, and healthcare prevailing globally. After having this detailed understanding of goal 3, which was on health and well-being, we also need to talk about some of the other goals, basically which are related to the health issues, because hunger is very much related to health. If a society is full of people who are not getting enough food, we cannot think of having a healthy society. So this is equally important. We'll talk about some of the targets here. Goal 2, zero hunger. 2.1, by 2030, end hunger and ensure access by all people, in particular poor and people in vulnerable situations, including infants, to safe, nutritious, and sufficient food all year round. So, although the targets are multiple, but if you go for the core target, it talks about providing healthy, nutritious food to all. Now, how to achieve that particular target? For that, there are several other targets that anybody can go through. Then there are facts and figures related to this. Current estimates are that nearly 690 million people are hungry, or 8.9% of the world population, up by 10 million people in 1 year and by nearly 60 million in 5 years. So we are having a huge number of people who are hungry, and this number is unfortunately increasing. The majority of the world's undernourished are still found in Asia. More than 250 million live in Africa, where the number of undernourished is growing faster than anywhere in the world. So earlier we talked about the sub-Sahara Africa and South Asia, and here you can see the correlationship where we have people who are hungry, we have infant mortality, maternal mortality, and other communicable diseases. Then we have goal 1, simply straightforward, no poverty. So the goal is very clear. We need to address the problem of poverty, eradicate poverty. Now, how to address this problem? For this, we are having several targets. By 2030, eradicate extreme poverty for all people everywhere, currently measured as people living on less than $1.25 a day. Yes, removal of poverty or eradication of poverty was also a target of the Millennium Development Goals. And again, this problem is persisting, right? Then there are several other targets related to this. So you can go through, but the core argument here is to address the problem of poverty, eradication of poverty. And here we must keep in mind that when we are talking about poverty, we are talking about actually absolute poverty. The concept of relative poverty will always be there, because income of two persons or two group of persons can never come can never become same, and some kind of relative poverty will always prevail, but the absolute poverty should not prevail. This absolute poverty should be addressed as soon as possible. And then there are facts and figures. According to the most recent estimates in 2015, 10% of the world's population, or 734 million people, lived on less than $1.9 a day, right? So here we have the estimates, and the targets become very clear when we see these facts and figures. Southern Asia and Sub-Saharan Africa are expected to see the largest increase in extreme poverty, with an additional 32 million and 26 million people respectively living below the international poverty line as a result of the pandemic. Now, the impact of COVID-19 and the pandemic is going to be very visible, because these two specific regions, the Southern Asia and Sub-Saharan Africa, they are worst victim, even if they were worst victim even before COVID-19, and because of this COVID-19, they are going to suffer a lot. So this problem of poverty is going to get worsened, and that needs to be addressed on top priority basis. Then these goals have specifically talked about sanitation and water, and so I would like to talk about two of these goals because we have already talked about sanitation in one of the lectures. So goal 6, target 1, by 2030 achieve universal and equitable access to safe and affordable drinking water for all. And then next one, by 2030 achieve access to adequate and equitable sanitation and hygiene for all, and end open defecation, paying a special attention to the needs of women and girls and those in vulnerable situations. So again, the goal is set as to provide or access to water and sanitation for all. So we don't have access to water, safe water, drinking potable water, and sanitation facility for all. Now, the targets are talking about different possible efforts and layers through which we can achieve this particular goal. Then fact and figures are also there. 1 in 4 healthcare facilities lack basic water service. So the healthcare facilities are not having water facility. And we know that the metropolitan cities or the big cities are going to witness or witnessing huge water crisis. So the next few decades are going to be a very critical from the perspective of availability of water, safe drinking water, and the SDGs have already understood this and brought water and sanitation as very important goals. Then quality education. So we all understand importance of education. Education was one of the goals in the millennium development goals also, and here also this is finding as an important goal. By 2030 ensure that all girls and boys complete free, equitable and quality primary and secondary education, leading to relevant and goal for effective learning outcome. So yes, uh, quality education and especially primary and secondary level education is a very important goal. Uh, it's very unfortunate that despite the presence of the no poverty goals or no hunger goals or quality education goals in the MDGs, we are still far away from those goals, and these goals are finding important places in the SDGs. So there are specific facts and figures. So basically in this lecture, we tried to address the health related goals, and we also talked about the food related goals or sanitation and water related or income related goals. And there are several other goals that we need to talk about uh, because those are very important in different contexts. And yes, some of these goals have do relevance, they do have relevance for the health related goals, like goal number 8, economic growth. We know that all these goals are not uh, possible without economic growth, and for that some kind of infrastructure development and industrialization is very important. Then goal number 10 is talking about minimizing inequalities of different types do exist. There are economic inequality, there are social inequality, there are structured inequality. So all kinds of inequality are basically some kind of disturbance, some kind of hindrance in the path of equity and equality. So these are very important. Then we have identified cities also as an important area of intervention and understanding. And then sustainable consumption and production. However, I would like to underline the remaining 3 or 4 goals which are very important and which are unique to the SDGs, that is the Sustainable Development Goals: climate change, oceans, biodiversity, forest, desertification, then peace, justice, and strong institutions, and some kind of global partnership so that we can address all these goals. So these goals are important now. These goals will remain important in next a few decades, but we should be optimistic that some kind of intellect and right kind of mindset should prevail among the global leaders, so that we can come together to address these goals, because these are necessary not only for the survival of an individual, specific individuals from coming from specific countries, but these are necessary for our collective survival. So thank you very much for watching this lecture. And if you have not watched some of my previous lectures, do watch them, because these are all in continuity. And I think each and every student should remain aware of these sustainable development goals. We are not talking about only the students or only the intellectuals, but these goals are important for each and every individual, each of us. So thank you very much for watching these, and do share this lecture with others, because some kind of awareness some is very important for playing some kind of meaningful role. Thank you.